Good evening if you are here with me, and good morning if you're watching a recording. I just was live in different groups, so I hope we can find each other now. I think so. Okay, good. I'm in a good place. Now, sometimes the technique is just, it's not where it's supposed to be. Anyway, so I'm so happy about today because few reasons. Today it's Wednesday and it's a hump day. So we did Monday when we talk about sugar, about how we can really improve our health by implementing what you learned here, cutting down the sugar, and then choosing the food that are grow in your garden. Yesterday we were emphasizing more about this, how important is to eat with the season. I was sharing some things on a Facebook, so you can have a look later on. And today it's a special session to me as well, because we talk about gut health. We talk about leaky gut. We will talk about inflammation, and it's so important to tap into this. Whatever you are working on now, either if you want to lose weight, or if you have rheumatoid arthritis and you have aches here and there, if you have headaches, if you just want to get healthier, it's so important to really tap into this, because this is just the hallmark of our health. We know now that all these gut bugs, they're running the show, and we have to really take care of them. So I want to really support you this week. By the way, I will drop the link if you. Hi, Nicole. I see you here. Great. I will just drop the link. Please take advantage. Only this week I'm offering this connect calls, so I can support you. So please, here is the link. If you want to talk to me, get more support, get on the link and register with me for the call, so I can help you, so you can really do some work this week that you will already feel it. Usually when people really are serious about their health, they already have some success this week, because when you stop the pause with sugar and with the refined carbohydrates for 10 days, we know from the studies, you can really improve already the liver enzyme and how the body works. You feel it already, that like you are lighter, you sleep better. So it's something that I want to really encourage you today. Just even after all this celebration and holidays we had last week, this is a great time to start as well. So today, again, if you don't have the workbook, we can send it to you. Just let us know and we can share the link. And today is session 3. And we will talk about insulin resistance, how it's all linked together, because the body, as we always, when you go to the doctor, you go to specialists, you will go to dermatologist, you will go to a psychiatrist, you will go to ophthalmologist. And at the end of the day, we are all one body, and it's all integrated. So this is something we have to realize. If you work on the body as a whole, all these aspects will just improve by itself. So as a first, I would like to talk about inflammation, especially and insulin resistance. Of course, it goes together, but the question I always ask, so is sugary diet causing inflammation? And answer is yes. And today I would like to talk about this a bit more in general, and because it's really so important. If you will understand that, then you will be able to make these difficult steps, which if you don't know, you would just, it's okay, I can have the donut today again. Because it's not the inflammation that if you cut your finger, it needs to get inflamed. So because it's essential for our survival. What I am talking about is this low-grade chronic inflammation that we as humans now suffer as never before. This low-grade inflammation really causing damage to and contributes to many diseases. In fact, some of these scientists really think that the chronic inflammation is probably one of the leading drivers of most serious modern diseases, such as this heart disease, metabolic syndrome, diabetes, arthritis, Alzheimer, and many type of cancer. So it's something we should be really serious about that, because we can really change it. As I said, you have key in your hand. last times or decades we were thinking that everything is due to genetic. Today we know it's not that true, actually, because yes, of course, we have some genetic makeup and we have some genetic predisposition, but how we will be feeling and what diseases will actually express, it's in our hand, and that's called epigenetic. And this is basically all what I'm talking about this week. We can really tweak the epigenetic, so maybe the diabetes will not progress, or maybe the rheumatoid arthritis will not progress, and maybe even it can improve. I can tell you quickly my story, why I'm doing all that. I told you my stories because I had this huge of inflammation in my face. I had rosacea. I had insulin resistance because I was scooping Nutella. I didn't take care of myself. But then I had, because I did my journey already and I knew it works. And of course, in hospital, I have to treat patients like an artist. I have to do, evidence-based medicine. But I always give people a paper with anti-inflammatory food, and just little kind of handouts. And then I had a patient, and he came, and so this guy, it was actually a man. He came with his wife, and he had diabetes, and he was very jolly. He was so happy. He sit on the chair and he was like, so just so happy. I said, well, you looking good. You lost weight, a lot of weight. Your diabetes improved. So he was able to really taper down his medication for high blood pressure, for cholesterol, and for diabetes. And I'm sitting in there and looking at his eyes, because of course, when you have diabetes, very likely people have a diabetic retinopathy. And I'm telling him how happy I am to see him with these results. And he said, what did you do? And he said, well, I did what you suggested last time. And when he said it, I was sitting there, I'm thinking, oh my gosh, I mean, is this really, does it really works? What we can do so much. And that was the point when I really I went seriously into this, and that's when I opened my sugar stop, and that's why we can be here together, because of my story and because of this man. This man changed completely the way how I look at these chronic diseases, because I see how much we can do beyond this, practice. When you go to the doctor, we don't have time to tell all this that we're talking about it tonight, because it's not yet mainstream. It's not recognized yet that is really so important. It's coming, but it's always kind of lag. There is always kind of delay when the science, something that we discover, comes to the mainstream physician office. There's always delay, which is like almost 2 decades. So we have to wait a little bit. So that's why we are here, because of this lovely man, that he and his wife were able to do that. And I'm thinking, wow, I wish this for everyone. And that's why I created this 5 days, so I can tell you everything as much as I can, not everything, as much as I can in these 5 days, so you can really have the basics that you can apply every day from now on, and really can just try, and do celebrate every little wins, because it's sometimes it's difficult. We have really habits that are so ingrained in us, and maybe we're not ready to do this change. We want to do that, but there is need to be certain readiness to do this work, because otherwise. And what about this? Can you hear me now? I wait. I'm sorry. Can you hear me now if I'm talking? Oh dear. Yes, you're back. Okay, good. Thank you. Thank you. Good, good, good. Very, very good. I should not touch this thing here because otherwise I'll make a mess. Okay, I'm sorry about that. Okay, so where I was. So yes, so yes, be serious about yourself, be serious about your health, because you are holding everything in your hands. You hold so much that I want you to know. I want you to know that you're confident, because you know the belief is big. I have so many times when people join the program or working, they decide working with me, they scared. They scared of the failure. They scared it will be difficult. They scared they will not manage. So I want to encourage you that you can do it, because I see so many people did it before you, and you can do it too. Just do little steps and little wins, and just keep going. And so back to inflammation. So we know from the research that there are common signs and symptoms that develop as results of chronic inflammation. It can be, as I said, the body pain. It can be chronic fatigue. If someone is always tired, it can be inflammation, insomnia, like the sleeping problems, as well the depression, anxiety, or mood disorders. It's all can be linked to inflammation. And obviously the gastrointestinal complication like constipation, diarrhea, acid reflux, all that, and obesity. That's something that people don't realize, that weight gain, it's linked to inflammation very tightly, and I tell you why later on. And so there are some risk factors that promote this low-grade inflammation and this inflammatory response. And these include age. There is more risk, higher risk when we age. There is obesity. Of course, when we obese, we have more higher risk to get this inflammation. There is a diet, obviously, high in sugar, high in processed food. That's what all we talked this week. All these, what we eat every day, this cookies and donuts and bagels and bread and pasta, smoking, and last point is stress and sleep disorders can be linked to inflammation. And but now I ask you, so I told you this, how many? It's 5. So it's age, it's obesity. So age, obesity, it's food, it's smoking, and it's stress and sleep disorders. So can you think what of these risk factors have in common? All of these, beside one, actually, beside one. They all have something in common. So I tell you that. Maybe. So little people come into my room. They're not sleeping. Anyway, I carry on. So the risk factors beside age are controllable through the lifestyle changes, which is huge, because we can all do something about it. We can lose the weight if we really want. We can improve the diet. We can quit smoking. We can work on stress and sleep. So it's out in our hand. Age, we can now as well. The new science from Harvard scientist David Sinclair, Professor Sinclair, is as well. We can as well slow down aging, as we can see. So it's something that I want to encourage you, that really, if you feel that you're inflamed all over, there is a light at the end of the tunnel, and you can find the triggers and calm your inflammation. I will tell you how a little bit. But before I jump to the inflammatory food, we talked about yesterday. We talked about anti-inflammatory food, which is super important. All the vegetables, all the green, all the red, or the yellow, everything basically that grows in the garden and you can find in a farm. Today, I would really love to tell you about insulin resistance, because it's so linked with inflammation. Because if we have elevated insulin, we have risk of chronic inflammation going on. And so what is insulin resistance? So maybe I'm sure you heard it before, but I just want to really explain it in a simple way. So insulin is a hormone that regulates the glucose level in the blood. So you have, we eat something, and the sugar will go up and insulin will go up. Depends what you eat. If you eat a cookie, the sugar goes like this up, insulin goes like this up, and then you have a crash. And if you eat vegetables, or some people, they are on ketogenic diet, the curve is more balanced. This is not such a spike, and that's why we're not on this roller coaster on going up and down. And today we know that insulin has effect on weight. What I mean by this is that more insulin is in the bloodstream, more weight gain. That's why it's really people who are on insulin medication, they really have difficulty to lose weight, because it's pretty impossible. It's against the biology. And so the insulin is also influence our aging and overall health. So it's really super important to really dive into this metabolic health, and to if you go to the doctor, ask him if he can check fasting insulin, because normally in doctor's office they check the the fasting glucose, but ask him as well to check insulin, because sometimes the body is doing great job to working on the glucose, but then if we have high insulin already in the morning, there is a really sign of insulin resistance. Or if always easy really to find out if we can have a risk of insulin resistance is when you take a tape, and if you have waist measurement more than 35 inches, that I will be, that there is a risk that you can have insulin resistance. So I would definitely see a physician and do some testing. But today I want to tell you what you can do now, because it goes like this. When you eat refined, highly processed carbohydrates, either if you drink soda or juice, or if you eat white bread, if you eat chips, cookies, or all these baked goods, this will lead to a spike of glucose and insulin. And then if you have too much glucose and insulin floating in the blood, this excess glucose will be stored as fat, most likely this abdominal fat. And what I'm talking is this belly fat, the inside the visceral fat, which is really kind of organ that creates inflammation in the body. And all these fat cells are hungry, and they contribute to as well to sugar cravings. So as you see how it's vicious cycle. So we eat all this sugary food. This will create insulin resistance, and then because we have insulin resistance, we have this belly fat, and all these the cells are hungry. They create cravings. So we again have a cookie, and this goes on and on and on. And then as well, what happened is because insulin resistance happens when we always eating these sugary foods, and then one day the glass is full. And how did it happen? Because we have cells in just really the way that you will understand, we have these cells in muscles and fat in the liver that they can lose, and they will lose sensitivity and capacity to respond well to insulin. And that's when they come numb, and they just don't react. And this is when the insulin knocking on the cell, and receptors doesn't do anything, and that's why we have so much glucose around in the blood. And that's when it's really in some organs it's even toxic. So in the brain or in the eye, when they go into these cells, we don't have the receptors, and that's why we have people with diabetes have these eye problems, because it can lead to blindness. So this is something I really want to encourage you, that this is big reason why you have to really cut the cookie, or have a cookie less often. But it's as well going a different direction. So the insulin resistance can as well influence us emotionally, because it can cause stress, it can cause anxiety, it can cause fatigue, cravings, as I said, and obviously hunger. So all these symptoms can drive the emotional decision, like overeating and cravings for fatty and high sugary foods. So this is where we are in this vicious cycle. This is where we are in this sugar roller coaster, because it's so hard to get out of it. Because as they call that, if you can't see the frame if you are in the picture. So we have to kind of recognize that this is, oh my gosh, this is maybe going on, and just step out of it. And how you do that? You do little steps that you learned today. Maybe you just look at the pantry and just take everything that has more than 5 ingredients, or that has ingredients that you can't read, because there's probably chemicals that will just be so harmful to your body. But just really be kind to yourself. Don't beat yourself up, and just start slowly. And that's why we are here today. We are making sure that we are aware what's happening in the body, and we are prepared for this with healthy snacks. You can do your best, going for walk, having good night's sleep, because all this that will really improve your insulin resistance. And that's why you will have less craving, and that way you will lose the weight, and that way you will just feel great. And I want to encourage you that the best way to reduce inflammation is really, it lies in your refrigerator, is all this food that I was talking yesterday. And so I hope you can start to see food as a medicine, because this food will give you really a completely different chemical reaction than if you will have this processed food. And as we were talking yesterday about the vegetables, that this is a great, again, I can remind you, for those who didn't see yesterday, all these anti-inflammatory diet, like tomatoes, the green leafy vegetables like spinach, kale, collards, all the nuts, the fatty fish like salmon, mackerel, all these food are anti-inflammatory, and they are really high in antioxidants, and they will do all good things in the body. And as I will tell you a little bit later, they are really good for gut microbiome. And that's why we have this, the best is, and most studied, is Mediterranean diet. It's so many science about Mediterranean diet, and we know that it's really, when people eat this type of diet, there is a really lower numbers that are associated with type 2 diabetes, and with strokes and heart attacks. So we know that this works. And as well, all the recipes that I develop are basically kind of Mediterranean diet, with kind of my little nudge. But it's really important to do a little like that. And so inflammatory food, what are they? So unfortunately, this will be the food that majority of people eat. So it will be all these pizza, the bagels, the French fries, the fried food, the hot dogs, and the snack food, all these potato chips, pretzel, corn and rice, corn cakes. But again, if you eat this food time to time, it's not a big deal. The problem is that if we eat only this food, and we don't eat any other food, then it will really, the body has no chance to kind of be in a good state of these. The body is, if you always have high sugar and high insulin when you eat this food, the body has no time to regenerate. And that's because we have always craving, so we always have this cookie, or this bagel, or this pretzel. So that's why we can do something today, and that's actually the homework today, which I will talk about it later. But it will be really helpful, because when people are successful is when they clean the pantry, because all the temptation, what is in the kitchen is in your stomach. This is like a rule for everyone, for me too. But I see when people clear the kitchen a little bit, maybe they will see how helpful it is. Because when you will have cravings and there is only cucumber or carrot in the fridge, but nothing in the pantry, there is no pretzels or chips, you basically have, either you make yourself tea, or you have this carrot, or you have cucumber or something else. But these just whatever it is you're eating right now, just I want to tell you that this food over time will create inflammation. So if you want to really improve your health and be feel great in your body again, then it's little by little, just try to cut them. It's not about perfection, it's about progression. So if you, it's about progress. So if you, for example, instead of I tell you how I did it. So as I told you, I was carrying everywhere macadamia nuts because we were living in Australia that time, and macadamia was kind of affordable because otherwise they're so expensive. So I had always macadamia nuts with me because I was craving so much everything because I told you I was dependent on Nutella, and so that helped me to go over this first period of really huge cravings that I had. And then I was adding food because it's not only about taking out food, but it's about adding as well. And so it's really super important to kind of plan ahead what you can have in a few hours. So how I did it, I planned my day and always prepare a snack or thinking what I'm having for snack every 2 days. So what I did when I was in work, I have a baggie with me with all sorts of stuff. I had the avocado, there's some nuts, some sardines, even banana, I think, some nuts. And when I was hungry, I would have something from that bag, and really it works fantastic because I know that if I need to have some snack, I have something with me. Because the worst thing is you're craving something, you go to canteen and here you go. I have a Snickers, I have this, and then you're starting the cycle again. And by the time when you do this, maybe just few days, even just this week, really, I promise you, if you do this only this week, you will see the improvement because you will have less cravings. Now I can tell you the people, so this new program started 2 months ago, and if the people after 6 weeks, I'm asking them, so how is the cravings? And say, I don't have any cravings, I'm doing fine. So when you are really working on your body, with kind of with the food that you're really feeding the body with this anti-inflammatory diet with all the vegetables and good lean meat and all these nuts and seeds, and basically you will get out of this cycle of the sugar roller coaster, and the body will be more on the you will be more in the fat burner than sugar burner, and you'll be less hungry and you'll have less cravings. So this is basically how that happened, but you have to kind of exchange it to better food, because for someone who is listening and has diabetes can be really dangerous, because you can go to hypoglycemia, and please don't do that. So always eat, but always get ready with some good snacks. I can share snacks with you, just let me know. Let me know in the comment if you have some snack ideas. I can share with you. And anything, basically anything that grows in the ground and is eatable, we can have as a snack. So you can have carrots, broccoli, cauliflower when it's cooked. Anything that hummus with celery is fantastic, or hummus with carrot. I can do a little session on the snacks, because that's usually what people really want, I can do that. So there's few things that really we can tackle the insulin resistance, and there are a few things that are really super important. So when we exercise, it will reduce the inflammation, and we will feel better already. I'm not talking about CrossFit or some marathon or some. I'm just talking about movement, just walking. And it's super important to really start doing this, maybe just 5 minutes a day, and then you increase to 10 minutes a day, and then you will create somehow 30 minutes. Sometimes people tell me, I don't have time for 30 minutes. Well, I understand, but you have definitely time for 5 minutes here and there, and try to stick to something that you do. For example, if you go for a cup of water, you do stretch or some movement, because the exercise is an essential step in reducing inflammation, and we don't do that enough. We are sitting and not moving enough. Second thing, I will talk more about that on Friday. Second one is chronic stress. Chronic stress causes stress, the stress hormone, to be continuously present in the body and causing inflammation. It's that simple. So, and there are countless techniques for managing stress. That from yoga, meditation, the guided imagery, gratitude, journaling, just walking, or just this deep breathing techniques. It's super helpful if we have something that we enjoy and we calm down. Another thing that it's really is just so essential. I can't express more how we're doing every Wednesday meditation with my group, and it's just I do it with them, and it just feels, yeah, we did it today. It feels so good. If you just pause for a second, you can really in 1 minute, if you have busy day in work, just 1 minute, just for yourself, just close your eyes, do 1, 2, 3 deep breath, 1, 2, 3, you pause, you hold the breath, and then 1, 2, 3, exhale. And try to exhale completely. There is nothing left. And the best if you do it with your stomach. So if you breathe in your stomach, not here. Because now we know from science that the capacity that you have in your lungs really can predict how you age. So it's something that we don't do, and we overlooked. And this is really, it will help you calm your stress down. It will help you to tackle the insulin resistance. It's super, super important. Another pillar that is really important to when we want to combat inflammation and really improve the insulin resistance is getting restful sleep. Sleep as well, I think it's overlooked, and we know from science that we having now epidemic of all kind of sleep disorders, and we just don't sleep enough because we have long to-do list, and we just think that we have to kind of you know it's not, we should not see sleeping as a weakness. If we need to sleep, we need sleep to rejuvenate and to restore, because if you wake up and feeling tired and feel sluggish during the day, you need more sleep. Another sign, if you are falling asleep and you are sleeping within few seconds, a few minutes, you need to have more sleep. This was as well, I speak for myself because I this was my big blind spot. I'm just too I like to do too many things, and then I just go to bed too late, and then I have to wake up too early. So that's why I bought my Aura ring. I don't have it now, but Aura ring now tells me, and it's I can't cheat, and I have to work on it because still it's like 6, 7, 6, 7, and I know I will be much feeling much better if I have 8. So I'm working on it. So I know that. If you like this as well, that you need and you have to do more, you have to work on your sleep, just do it and try. And there is I will talk about some sleep routine on Friday as well, but really we need 7 till 9 hours of sleep each night. And with the sleep it works like this: you cannot make up like I will I will catch it up. It doesn't work like that. Our body doesn't work like that. And as well, I will talk about the circadian rhythm on Friday. So that's something as well that we know it's super important to follow. And so that's how with these, if you just remember the sleep, you remember the stress, and you remember the exercise, and you choose good food. I know it might be a lot, but you will see that magic will start happening in your body, because you will feel much better and better. So that was really like real quick breakdown from the insulin resistance and inflammation, because it goes so close together. And today I as well want to talk about the leaky gut, because it's linked to this as well. We know now that the gut is, Hippocrates said this many years ago, that all diseases begins in the gut. And now we know how true that is, because now we have all these science that's coming up every single day as we speak about the gut microbiome and leaky gut. And so this is something that we have to really be careful and learn about it, because it's important. So you learn about the food that can create inflammation in the long run. Obviously, you learn about food that calm inflammation. So and now I want to tell you that what is leaky gut, because there is so much information on the internet, and majority is quite all right, but I just want to give you kind of insight how it is and how you can really improve it. So I did a little sketch here. I hope you can see that. I hope you can see that. So this is, so if so we are in the gut here and this is the cross if you cut the gut, and this is basically the wall. And as you can see, like, you know, the gut is like the tube, and if we cut it like this, and that's the wall, it's just this side. So I go a bit closer. So this is good looking gut. This is inside of the bellies. We have this extensive intestinal lining that is covering more than 4,000 square feet of surface area. So it's a lot of space with all these cells, because it's like this, right? And these cells, to be able to work properly, they have these tight barriers that control and what gets absorbed into the bloodstream. So this is kind of the food, and this is the stool that goes out, and this is the mucin layer. These are the cells, and this is the bloodstream. And you see all these cells; those are the blood cells. And if the barrier is tight, then we know really what goes in, because nothing goes in, only particles that the cells say, okay, this can go in, and goes in and doesn't create any inflammation. Here on the other side, in unhealthy gut lining, we can sometimes have large cracks and holes, allowing these particles or partially digested toxins or food or bugs penetrate to the tissue beneath it. And this is basically what is leaky gut, or we call it intestinal hyperpermeability. And this is what it sounds like. So the digestive tract is not longer able to ensure that the good stays in and bad stays out, because we don't want this in a body, because we would die within a second. That's why we have this important barrier in our gut. And so these tight junctions, they are really broken, and they're not holding the walls together, and they are loosened, and that's why we have these gaps, and all the things can go in, and the cells can't control it. And why I'm telling you this, because imagine if things go here in the bloodstream, the body reacts to this foreign particles, because these produce, the body is saying, oh, what is this? I don't know this one. So they produce the immune antibodies, and then the pro-inflammatory cells, and they fight them off. And that's why this breeds chronic inflammation. This breeds food allergies and various health complications. So we know that now the science is showing us that even autoimmune diseases probably has this problem as well. So it's really something that we know it's serious. Fortunately, we have better understanding today of the causes and of obstacles and treatment, actually. So there is a cycle to stop it, and there is a stop to the cycle. And the research world is booming today. We have study again showing that, you know, the modification in the intestinal bacteria and inflammation play a huge role. I told you before that there is a huge science about the fecal transplant for the diabetic patient, and as well for the autistic children. So we can do so much about this. And we as well know that this intestinal permeability, you can get tested as well. But the thing is, we know that it's not only for people. So not only people who have some certain gastrointestinal condition like celiac disease, Crohn's disease, or irritable bowel syndrome, we would suspect that they have leaky gut. The leaky gut may cause problem elsewhere in the body. And that's why it's something that we recognize recently. That's why people who have skin issues, most likely they have a leaky gut. I have one lady, she has rash. she improved leaky gut with the diet. She did some more thing, and her rash disappeared. So you can really do so much. Arthritis, another one. It can be all linked, even mental illnesses. They say leaky gut, leaky brain. I would say leaky gut, leaky eye, but we're not there yet. So I'm just telling to you this. But this is so important that we have to really look at this gut. If you because I think still it's a missing link. As well, the obesity can be linked to this, because we know, as I told you yesterday a little bit about the gut bacteria. We know that certain bacteria will just breed obesity and certain bacteria will not. And so it's something that, again, with the food you can really modify. And all these food that I showed you yesterday on this plate, all these, healthy diet in terms of, so all these vegetables and the fruits and lean meat and really good fat, this is anti-inflammatory. This will help you with the leaky gut. And we know there are triggers for leaky gut too. So among the most common one is alcohol, is the processed food, is of course is sugar, and is gluten. And those are the big items. So the alcohol is clear, obviously it's damaging everything. And as well, I'm not talking about one glass of wine once in a month. I'm talking if someone is really consuming alcohol every single day in a higher amount. Processed food it's serious, because now as well children, they have these snacks in the snack bags, and it's really because all these snacks, they have this toxic kind of food items. Is not even food. And all these emulsifiers and all these things in the snacks, they really causing basically they damaging this mucin layer that we want. This mucin layer, especially the emulsifiers, and we ended up losing the mucin layers, because in these mucin layers, the bacteria live in it, and we need this mucin layer to be functioning, to protecting our cells. And if you disrupt it, the bacteria can really damage the cells, and then we have leaky gut. So I think a lot of people have leaky gut. I had leaky gut as well when I was, I still have it a little bit. I didn't test it, but it was much less. And so there is you can really improve it with a healthy diet. And what is really important to realize, it's not only food. So I see how people spraying their lawns with all these Roundup, and we know from science that this is a huge trigger for human health. It's really it's detrimental to our health. Not only that it's cancerogen, but as well it will have bad effects on gut health and on the gut integrity. So it's not only the food, the sugar, the gluten, the alcohol, but as well the exposure to chemicals. So if you can, and Nicole was sharing yesterday the link about the Clean 15 and Dirty Dozen. If you can, try to buy organic food, because you don't want to have these chemicals in your body, because you might think you're doing well for your health if you're eating blueberries, but blueberries are the ones that are really heavily sprayed, and so you just causing your body harm. You're doing harm to your body, because you're eating with the good blueberries as well the really bad chemicals. And now we are talking. I touched gluten a little bit yesterday, but gluten is really makes our gut leaky. It's simple as that, because there was a huge scientist in Harvard. His name is Professor Fasano. He's Italian, and he did extensive research about leaky gut, about gluten, and he showed that gluten causes leaky gut to every single one of us. And basically it opens the cells in between. The gluten will open it up, and then when after some time it will close. But if you imagine we're eating gluten all day long, after some time it will not close, because we just eating gluten all the time. So this transient leaky gut basically will not happen anymore. And this is a big problem, because if it's too much, too often, we will see some symptomatic symptom. But the thing is that many people actually don't realize that they have this problem, because they say, "Oh, I'm fine. This is not my problem." But the problem is that we might have leaky gut before we have the serious problems. So it's something like same with the eyes. People might have diabetic retinopathy everywhere in the eye, but not in the macula. And then they come because they didn't have a visual symptoms, and then it's like, oh my gosh, it's so much going on here. It's same with this. So unfortunately, gluten is everywhere these days. It really sneaked to our food supply, and so that's why it's really important to watch it, because disguised in all the packaged food, and it's really featured as well in these most prepared dishes. So it's something, and I'm not talking about someone who has celiac disease. I'm talking about all of us, because there is of course there is allergies, there is sensitivities and intolerances. They are different things, all these things. Three things. So it's something that we have to really be aware of it. And I think there is quite a buzz about the gluten-free diet, but I would just like to share with you that the gluten-free doesn't mean that we go from the refined grain that is with gluten, to the grain that is with not gluten, that is like refined, any other flours. This is not the good scenario. It's the same like if you go from the sugar to sugar-free, but you will use all kinds of different sugar, like the artificial sweeteners, which are really harmful to our body. We know that they are detrimental, because they damaging they have really bad effects on gut microbiome. So that's why gluten-free means that you choose just grains that are whole. Yes, you can choose the gluten-free grain, but it's not refined. And you, instead of this bread all the time and pasta all the time, you will maybe choose vegetables. Like you will do instead of pasta, you will do zucchini, with the spiral, or you just have a carrot or something else. So it's something that we have to really consider. That's why that was your homework yesterday, and just have a look today as well. That it's really in many. All these snacks, all these pretzels, all these chips, they all have gluten, and they all then, as you can see, they will do this damage to our gut, which is really something that we have to work on. So the where is gluten? Is obviously in wheat, is in rye, is in barley, is in where else? It's in sorghum, I think. Yeah, and there is. And then sometimes people are actually, they might not be, they thinking they take out all the grains, but no. Some people, they have sensitivity to gluten, but then they eating rice. But because there is something that calls molecular mimicry, they will still don't feel well, because they still having the other grain. So because they all have these proteins, like the wheat has gliadin, the rye have the secalin, and oats has avenin. So if you are having something in the body that needs to be kind of improved, and you just having all these different grains, it's still maybe you need to do a pause for 1 week and see how you're doing. But we can do so much by improving a diet to really heal the gut microbiome and leaky gut. And what is the one thing that I tell you to really fit into your daily, or not daily, but definitely weekly, but I do this every single week, and that is I cook chicken soup. Luckily, I have a farm here, and the farm is selling as well the chicken feet. And it's wonderful, because the feet has a lot of skin, a lot of joints, and this is what you want. And so I throw in the big pot the the chicken, either the bag, because they have really great they're selling only bags, and so, but you can do all chicken as well, it's fine. With the skin, with the bone, with the meat, it's very important. I see that people mixing meat stock and bone broth. There are two different things. Bone broth with the bones cook, I don't know, overnight, will not give you the nutrients that you need to heal your gut. It has completely different type of things. It's rich in minerals, but what you need are the amino acids that are building blocks for the gut. So it's really super important. So how you do the soup? You have big pot with the water. You throw there the feet and the chicken, and it's really simple. Just one onion, one carrot, one celery, and some spices and salt. But from the spices, I would do piment and pepper, and that's it really, and bay leaf. And then you just boil it for 1.5 hours, and you have a delicious soup. And then you first of all as well, you have to drink it like a tea. And sometimes I do 1 week kind of like soup week, or how I should I call it. And I just do that. If I feel like I'm a little bit not in my skin, I do this, and I see even my skin just improves, because it's just so healing. And that's why maybe your grandma, she was preparing you soup when you were ill, when you were sick in the bed with colds, because they knew why it's good, and it is good. There is even a whole diet called GAPS, GAPS. There's one Russian doctor, and she's actually in the UK, and she is healing her patient with this chicken soup. So it's science is there, and I know that it helps many people. It helps me too. So it's something to think about. So this was it today. I know today was like a little bit of mishmash of everything, but please, I really have a look to this booklet. And if you have any questions, let me know. I will have a look in the chat, what's happening in the chat. So Nicola, is he doing a great job? Thank you. Yeah, the gut health is really everything. It's everything. Sonia saying definitely need this. Okay. Yeah, and book the COVID me this week. This week I really make special space for this, so make sure you do that. And I will have a look what's happening in fasting insulin. Yeah. Yeah, definitely small step. It's like I was talking about it yesterday, the domino effect. Like if you want to knock down the big domino, you have to knock a little bit of the small dominoes before, and then you easily knock the big one. Yeah, Nico was saying this 1, 2, 3 inhale. It's like a box breathing. So it's really, you inhale, you hold, you exhale, and you do it again. And it's really magical. Just try it. Yeah, this is way how to improve. Yeah, so good. If no question. If you have any question as well later, just let me know, and I can answer it. I can answer it tomorrow, or I can do extra video for that if you would like. Yeah, so this was today. I hope it was helpful for you. Again, make little step that would really lead you to a better place if you do them every day. Again, it's not about perfection, it's about progress. So take care of yourself, have a good night, and I will see you tomorrow.